Hormone replacement therapy isn't a zero to nothing process. It's really a kind of jump rope exercise where we're watching the body, seeing what's happening, seeing where certain hormones need support, and then jumping in appropriately at that time. And that's why usually we start with just progesterone. So 35 years old onwards, even if we're ovulating every month, having regular periods, we tend to make less progesterone. And if that particular woman is under high stress, she'll have even less progesterone because she'll poach the progesterone, convert it into cortisol in order to continually stress out / be productive, get everything done that she needs to get done. So what we see is women in their late 30s might start developing some symptoms of low progesterone, and then in the 40s, usually this is a common thing that we see. So it might be appropriate at that time to do things, of course, to lower the stress level so that more progesterone can stay in the hormonal tank. And beyond that, maybe using herbal support to boost up the progesterone. And if needed, we can even consider adding in some progesterone, some bioidentical micronized progesterone in the second phase of their cycle, the luteal phase, where they would be making progesterone anyway. So it's really just like a little top up where needed. So women who are having symptoms of anxiety, irritability, insomnia before their period, boosting the progesterone can be really helpful. The next thing that we would maybe do is as they get closer to menopause, so once they start missing ovulations, when the periods get further spaced out, progesterone will be dropped even further, so we may have to increase the dose of progesterone, but it also might be appropriate to start including some estrogen, and that again could be boosting with herbs, or it could be using bioidentical progesterone cream. We never do oral estrogen at this stage. There's enough research to show that that's not usually a good idea for most women, but topical estrogen can be really helpful. So we may add in a little dose there. But as the woman transitions to full menopause, her hormone levels, her endogenous production of those hormones will change, and therefore our top-up strategy will be a bit different too. So it's not like you get diagnosed with something very specific, you get a specific rigid prescription and you continue it for a very long time. It's really requiring some regular check-ins, and we usually check in every 6 months to make sure the prescription is still appropriate, still safe, and still as suitable as possible.